being overturned are greater than we ever could have imagined, because it's not just what's happening in the moment, but also what's to come. In a new piece for MSNBC.com, Dr. Kavita Patel has a dire warning about the future of OBGYN medical training. Dr. Patel writes, quote, almost half of the nation's OBGYN residency programs are in states that have or will ban abortions, which will create crucial gaps in medical education. This, in turn, will make access to equitable, high-quality reproductive health care impossible or severely lacking for patients. Dr. Patel joins me now. Dr. Patel, it's great to see you again. Thanks for joining us. Tell us more about your concerns. It's not something I had heard before, but once I read your piece, I was, of course, thinking like, yes, there is definitely going to be a ripple effect, not only in the practice of the care, but in the training and the medical education future doctors will receive.
Yeah, Eamon, and it goes beyond OBGYNs, and that's part of the point I wanted to make. So I'm an internal medicine physician, board certified and trained. I trained in emergency rooms. I trained in OBGYN residency rotations alongside other OBGYNs, surgeons, anesthetists, and other doctors to understand how to recognize many complications, everything from ectopic pregnancies to a failed pregnancy that might not have, that a mother might want to have carried to full term but was unable to, started bleeding at around week 19. These are all things that present in a number of different settings, but all hinge on having that adequate training, with 43% of training programs in states that won't even allow for faculty to develop. Eamon, think about this. If you don't have students, fellows, residents, and faculty who understand how to teach and actually carry out these procedures, or even instruct someone to carry out these procedures with confidence, it's not just lack of access to abortions, Eamon. It's everything from miscarriages to recognizing complications of assisted reproductive technology. Anything could be on the line, and that's exactly what's happening.
Could medical training programs work around these bans?
So yes, that's what, so there are, of course, medicine, like many other areas, are highly regulated, and there are guidelines for residency programs, medical schools. That's a good thing. We have accredited standards and bodies which regulate all of these training programs, and they do, in fact, Eamon, require that there be some standards. But in these states, those standards are going to be severely restricted. States like Louisiana, which had one clinic that it could send its residents to, will probably have no options for an entire state, and that is going to be reproduced across the country. So what will likely have to happen is that residency program directors will have to scramble and try to find virtual options, or Eamon, they might have to try to send students and residents, fellows, and faculty out of state to states like where I practice now, the state of Maryland, but there are not enough slots, and of course this creates inequitable access, because which types of residency programs and hospitals can send people out of state? Ones with money, ones with access. City hospitals, urban hospitals, public hospitals will be the last places that have the luxury of sending people. So it's going to become an incredibly important issue, and it does not just affect women, it affects all families, because reproductive care affects way beyond the person carrying a pregnancy.
Even if the Supreme Court makes a move years from now to allow abortion once again, do you think this will still be a problem for women?
It will, and all we have to do is look at my home state of Texas, where many of these restrictions have started for years now. It is very hard to find obstetricians and gynecologists who have some of the training in some of the procedures, such as dilation and evacuation. Some of these very basic procedures that would be considered standard for any OBGYN or person training in these specialties to understand how to do. But because of so many severe restrictions, again, not just Texas, but that's one example, there are very few doctors who actually have that training. And if you don't have training in it, you can't teach it. If you don't teach it, then you really hold back generations from understanding this. I'm not saying this to say it lightly. It reminds me of third world medicine. When I would go to countries such as Mexico, and parts of Central America, India, and Asia, I would see the lack of this training. Fast forward, Eamon, just 4 to 8 years, because that's the cycle of a resident. Just fast forward that amount of time, we will have residents who have had none of this training and no option for that training in many of these states. It should make everyone pause, because that's not what our country is built on. Basic health care will be taken away in many of these places.
Yeah, it's an absolutely scary thought. Dr. Patel, I wanted to switch gears for a moment, if I can, just before I let you go. White House Chief of Staff Ron Klain spoke with my colleague Symone Sanders about the Biden administration's preparations for monkeypox. Take a listen to this.
Yeah.
We've been taking steps to ramp up the acquisition of the vaccine, to get the vaccine distributed in this country. You're going to hear more announcements about this in the coming days, Symone. We take this very seriously, and we know that particularly for the communities that have been most affected, they need us to get this vaccine where it needs to get to as quickly as possible. That's what we're working on. We want to try to contain the spread of monkeypox and try to make sure this does not become an endemic virus in the United States.
Dr. Kavita Patel, your thoughts on our preparations and our ability to combat monkeypox?
Well, I mean, having just made a recent diagnosis in our community here in D.C. myself, I can tell you that I agree Ron Klain is on point with what they're trying to do, but I mean, it's not good enough. And I do think we're past the point where we're kind of trying to contain this and prevent it from becoming endemic. What he's really describing is that we want to prevent the community spread. The community spread is occurring. I do worry that we've unfortunately discriminated against gay, bisexual, and transgendered populations by trying to say that they are the only ones that are high risk. They're certainly amongst populations that are high risk, but we're missing community spread. We've had children with monkeypox diagnosed. We have had people outside of what we would consider high-risk populations diagnosed with monkeypox, and that indicates community spread has occurred. I think what would be great is if the administration could add to what they had just mentioned, what Ron Klain had just mentioned, by literally simply putting out easy to understand graphics and information so that people such as you or anybody you know could say, you know, this is an unusual rash. I don't feel so good. I do think I should just get checked out, because that's what we're seeing. We're seeing people present that said, I don't have any history of travel. I don't have any of the behaviors that people have warned that might be high risk, but I have an unusual rash, and it's turning out to be positive. So good news, though, Eamon, is that the majority of cases are self-limited, don't progress to hospitalization. But the key is getting identified so that we can isolate patients so that they don't unintentionally infect others. And I think that's where we need to concentrate our efforts on. We don't have enough vaccine for everyone. We're getting more. But if we could prevent people from not spreading it because they didn't even know they had it, that would go a long way in containment as well.